The title of our topic is called The Role of Traditional Chinese Medicine During the Time of COVID-19. So let's start with the definition of what is traditional Chinese medicine, or in short, it's called TCM. It is a systematic study of human physiology and pathology that is dealing with diagnosis, treatment, and prevention of diseases. Here we could see it involves two things. First is physiology, which is a branch of biology that study how living things function. And another one is pathology. So what is pathology? It is the scientific study of the nature, origin, progress, and cause of diseases. Now, here in Philippines, we have a regulatory institution called PTAC, which stands for Philippines Institute of Traditional and Alternative Healthcare, that handles the practice of TCM here in Philippines, which this institution is under Department of Health. And beneath PTAC is a newly formed committee called NCC TCM, which stands for National Certification Committee of Traditional Chinese Medicine, who is in charge and to approve applications from those who would like to be certified and qualify as traditional Chinese medicine practitioners, and also Chinese medicine dispenser. Here, it also involved in the accreditation of TCM training centers and their programs, and also TCM clinics as well. We are guided with the rules and how we're going to work with the applications. And in the guideline, there is also a definition of what is TCM. So let me read it to you. So traditional Chinese medicine is a coherent and independent system of thought and practice rooted in the philosophy, logic, sensibility, and habits of Chinese people. It's a result of continuous process of critical thinking, as well as extensive clinical observation and testing, which involves Chinese herbal medicine, acupuncture, moxibustion, or tuina as major treatments. Here we could see the word coherent. In my own understanding, it means quality of being consistent and togetherness. From the definition, we can also read there that it is the habits of the Chinese people. So there's no doubt that TCM is originated from China, which is considered as a cultural heritage of the Chinese people, which been existent for more than 5,000 years, or also known as quintessence of Chinese culture. So we notice that it is originated from China. Then let's look at how China National Committee for Terms in Sciences and Technologies describes TCM. So it says, the formation of traditional Chinese medicine is mainly based on two things. First one is, it is based on practical experience. And the second one is Chinese medical principles and theories. So what are these medical principles and theories? These are the concept of yin and yang, okay, the 5 elements theory, the 6 pathogens theory, and also the meridians and acupuncture theory, and so on. So generally, it is a comprehensive science in the study and research of human life and activities, pattern of diseases, and its transformation and prevention, which include diagnosis, treatment, rehabilitation, and healthcare. So we can see here it involves 3 aspects. One is prophylaxis, or we call it health preservation. And the second one is to prevent disease transformation or curing the disease as soon as possible in order to prevent the pathological evolution from aggravating or getting worse. And the third is to prevent recurrence or new disease after recovery. Okay, here are the four modalities which we commonly use, okay? So let me define and describe with you. First is the Chinese herbal medicine. These Chinese herbal medicines are in various forms. It can be in the form of powder, pills, oral liquid, tablet, paste, patch, granules, or decocted soup. It can also be in the form of injectable solution or intravenous fluids, and so on, which its ingredients are mainly plant-based, but sometimes preparations may include minerals or animal products. And decocted soup is the most commonly used, okay? So essence from these materials or ingredients are being extracted by boiling it in water. One is acupuncture. It is an act of inserting very fine sterilized needles into the skin where specific acupuncture points are located for the purpose of clearing away the obstructions in the meridians or pathway where the energy and blood flow in order to correct various illnesses or ailments. Then we have also other kinds of needles that are being used, okay, in different sizes and in different appearance that are for different usage and purposes. Then next, we have the moxibustion. It is a herbal heat therapy manipulated by igniting herbal preparations, then applies the heat generated from it to stimulate specific acupuncture points or meridians in order to regulate the body system. The main ingredients here is called aiye, okay, or simply called moxa. Heat that's generated from burning the moxa has the ability to travel or pass through the meridians till it reaches the focal area or targeted organ for treating diseases. So this kind of heat is totally different from, okay, ordinary heat. Then last, we have the tuina, also known as tendon manipulating techniques, which is a specialized medical massage modality of traditional Chinese medicine. It is a skill exerted with strength and stroke varieties by hands or elbows of the practitioners on patient's body surface to stimulate acupuncture points and meridians in order to regulate the body's physiological and pathological conditions. This modality is very effective, particularly used in treating musculoskeletal disorders, which is my specialty. Then, of course, aside from using these four common kinds of treatment method, we also often applies the cupping, bentosa in Tagalog, and also skin scraping, or is also known as guasa in Chinese. Okay. Then starting last year and nonstop till now, all of us are experiencing the COVID-19 pandemic. It is really a global hardship and no one is being exempted. In TCM, COVID-19 is considered as a plague or known as, okay, pandemic in Western medicine. And according to some experts, the name of this disease, of course, we have, we know it as COVID, novel coronavirus, right? And in Chinese, it should be called pulmonary pestilence. In TCM, we have to do syndrome differentiation on patients, which is to analyze what are the characteristics of the involved pathogen or pathogens. Here in COVID-19, it is generally classified and caused by a substance having the characteristic of being nauseous, okay, dampness. Nauseous here means poisonous, okay, which is also mixed with wind cold. In TCM, we do syndrome differentiation, whether this disease is belong to a wind cold type or a heat, okay? In Western medicine, it is caused by a newly discovered coronavirus that is highly contagious, a communicable or infectious disease named as novel coronavirus pneumonia. Okay, when people who contracted this virus, they may be asymptomatic or presymptomatic, and after that, they may get sick and possible of losing their lives if, okay, they have serious complications afterwards. So those people who are discharged from the hospital doesn't mean, okay, they are really get well, okay? And based on the report, many of them are still suffering from residual symptoms. So here, many people are affected, not just only physically, but also economically and mentally disturbed. So where the disease started is still unknown, okay, where the outbreak actually started. But it is China, the first country of China first who detected this new virus. China almost, okay, China almost into full control and has contained the spread of this virus through strict rules and implementations. And in addition to that, they also, okay, employ traditional Chinese medicine as the main treatment to COVID patients in conjunction with Western medicines. So let me report to you what had happened during the time when they have their lockdown. The lockdown date was January 23 last year. Okay, so traditional Chinese medicine academicians first arrived before the Chinese New Year, which fall on January 25. They went to the seriously affected areas, visited hospitals, okay, performed diagnosis on patients and assessed the overall situation. Then decision plans were made. So they decided intervention of traditional Chinese medicine was indeed decided, and herbal decoction formulas were prescribed in order to stabilize the chaotic situation, as what one of the academicians named called Zhongnan San had said, Chinese medicine should intervene at the beginning and don't wait until it is too late. So on February 2nd, 2020, the authority gave the go signal for mass production of herbal decoction. 27,000 packs of herbal decoction formula number 1 was immediately produced and distributed during that night immediately, and then succeeded by big volumes. More than 800,000 packs of formula number 1 alone, okay, were produced and distributed to accommodate more than 50,000 patients in Hubei province alone. Another 90,000 packs of formula number 2, okay, were also produced. Still, they still have the formula number 3 and so on, okay, were being produced and distributed during that period. So aside from those Chinese herbal medicine mainly for treatment, okay, there were also herbal medicine, okay, for prevention in non-stop supply. Now, after that, on February 6, which is 4 days after the initial mass distribution of herbal decoction, it was reported that the increased rate of infected cases percentage had dropped by 30% and still continued to decrease onward. So this indicates how important, effective this traditional Chinese medicine, okay, are, which has played a vital role during this pandemic period. So in Chinese, there is a saying, 一方有难,八方支援. So what does it mean? It means when disaster struck in one area, help will come from all sides. So a total of 346, medical teams composed of 42,600 medical staff across China were sent to Hubei province. Inclusive here, okay, in the above number are more than 3,100 medical staff of 630 traditional Chinese medicine hospitals from 28 provinces. So the State Administration of Traditional Chinese Medicine had also sent 4 national teams comprising of 588 TCM practitioners to treat patients using traditional Chinese medicine treatment method. So this is a picture of those who had assigned in a temporary hospital called Jiangxia Fangchang Yuan. In English, I translated into Wuhan Jiangxia Temporary Hospital. So aside from those existing established hospitals in Wuhan, 16 temporary or shelter hospitals were also quickly converted from public venues to meet up the demand. On one of it is, just I mentioned, Wuhan Jiangxia Temporary Hospital that had medical staff assigned from 20 TCM hospitals from 5 provinces. They mainly use traditional Chinese treatment methods in treating patients and only with a few IV infusions. So in addition to providing herbal medicine, these TCM practitioners also perform acupuncture, moxibustion, tuina, and also this one called auriculotherapy. Okay, these are by putting off air beads on the air. In herbal foot bath also, and they also teach the patients qigong exercises. Okay, also, okay, they don't just only use Chinese medicine methods, they also use modern medical testing equipment such as the CT scanners. So this is the picture of this Jiangxia Temporary Hospital, and you can see it inside, okay? There's a lot of beds, and China Central Television, the CCTV, Xinhua News Agency, and other broadcasting agencies had uncurtained several scenes and reported what had happened inside this hospital. So here are the pictures. The first one on top is a patient who is sitting down, and the medical staff, they put a herbal patch, okay, which is automatic heated, okay, on the C7 area at the back of his neck, okay, for treatment. And down there is another picture, okay, a medical staff putting also this kind of herbal patch, and the patch putting here is called strong kidney moxibustion, okay, on the lumbar area or at the back side there near the waist area. Then on the left picture, you can see what I mentioned a while ago, this auricular therapy. You can see tapes on the air, and beneath that are herbal beads or herbal medicine called Huangbu Liuxing in Chinese. And this application is very effective, particularly in stress management. Then on the right side, you can see a ama sitting down there with both of her legs, okay, of feet put inside in a bucket of herbal soup. So during the 26 days of operation in this Chinese hospital that was converted from a sports center, they had received 564 patients, approximately accounts 71% belongs to mild cases and 29% in moderate condition. And what had happened, none of these patients have turned from mild or moderate condition into severe or critical condition. And the medical staff there, okay, neither one of them was infected because they are provided with this auto heat moxibustion herbal patch, and they are encouraged to drink herbal tea as prophylaxis. Now, among the 564 patients, 482 patients got cured and were discharged from the hospital. But another 82 patients, including here, are 14 patients who have underlying conditions, the diseases. They are requested to transfer to other designated hospital because this hospital had to be closed, okay, for they have not yet reached the discharge standards before this temporary hospital closes. So they need further treatment. So here we could see during the course of this pandemic, the National Health Commission and National Administration of Traditional Chinese Medicine of the People's Republic of China has released rapid advice or guidelines for frontline clinicians as guidelines to follow. and the section on how to treat novel coronavirus pneumonia based on traditional Chinese medicine principle and theory, and also the recommendation of using herbal formulas, okay, for each stage with syndrome differentiation are also clearly stated. Among the herbal formulas found in the guidelines, it is the so-called lung cleansing and detoxifying decoction formula, which is also called Qingfei Bai Du Tang in Chinese, okay? That is recommended as a general prescription, okay? General prescription suitable for all patients in different condition, whether having mild, moderate, or in severe condition, and may be also used as a supportive treatment to Western medicine on those who are in critical condition. This formula is consisting of 21 ingredients, and you can see it here. Okay, you can see 21 ingredients here with its English translation or in Latin name with the respective dosage. So this one is for treatment purpose. So what is the treatment purpose of this formula? Okay, and here are these. First is for diffusing the lungs and expelling the pathogens. Then also for dispelling filth. When we say filth, these are metabolic waste or dirts, and also for removing turbidity. The turbidity here means sticking thick phlegm. Okay, also for invigorating the spleen to eliminate the dampness, and also for detoxifying and clearing the obstructions in the collaterals and meridians for the qi, okay, the energy and blood to flow back smoothly. In TCM, we don't just focus on targeting in killing the virus itself, instead focusing on how to adjust the body immune system in order to clear the symptoms and reduce complications. Okay, and that is how we treat the disease at its root cause, helping the patients to recuperate or recover from disease radically. Now, okay, you can see on the right the picture of the decocted soup named Qingfei Bai Du Tang. According to the report, as of March 9, 2020, a pharmaceutical company, okay, has totally distributed 380,512 packs of lungs cleansing and detoxifying decoction, okay, to Wuhan, okay, just only this formula alone. And 5 other companies outside of Hubei province have also provided Wuhan with more than 100,000 sets of this formula, but it's in granules form. So here are the data that were released by the Medical Affairs Department of China National Administration of Traditional Chinese Medicine as of mid-March last year. 1,261 patients from 10 provinces who contracted the disease had took this formula and participated in the clinical trial. So this formula, I mean lungs cleansing and detoxifying decoction. The clinicians have found out this formula excels than the other formulas. It has achieved a very promising, successful, effective rate of 97.78%. And that's the main reason why why China National Health Commission keeps on recommending the use of this formula. According to the Medical Affairs Department of China National Administration of TCM, the proportion or participation of TCM in the treatment of novel coronavirus pneumonia in Wuhan was 89.10%, okay, during that time, and 92.41% overall across China, respectively during the first quarter of last year. Okay, there were also cases that had spurred up in several places later last year, okay, such as the one in Jilin province, Qingdao City, Xinfadi Market in Beijing, Heilongjiang, and other places. And the rate of using Chinese medicine on confirmed COVID-19 patients were later in 100%. So now let's go to recovery stage. As what I had said, a portion of patients released from the hospital may still experience lingering symptoms or so-called residual symptoms for weeks or months. Some patients may also develop medical complications that may have lasting health effects. Okay, here we don't just only pointing on those patients who were severely or critically ill, but also it happens to people who had just only mild symptoms and they still have these problems until now. So in the guidelines, there are 2 listed herbal decoction formulas, which are recommended to be used for treating patients during the recovering stage according to syndrome differentiation, and is generally classified into 2 types. The first one is the one for lung and spleen qi deficiency type, and another one is for both qi or energy and yin deficiency type. So in TCM, we also give much weight or importance to prophylaxis. In order to contain the transmission of this novel coronavirus, many provinces and municipalities in China, they have their own experts to prescribe their own formulas as preventive measure in order to protect those who are susceptible in acquiring the disease. So Chinese herbal mixture were also distributed and given out for free. My associate, who is in Wuhan, Hubei, had also forwarded to me the 2 formulas they use in Hubei for frontliners as prophylaxis, which has the effects of clearing away internal heat and for detoxification, expelling dampness and turbidity, and also can enhance immunity to improve our immune system. So here's the formula. Here are 2, they sent it for me. And the first one, is composed of 6 ingredients, but you can see the dosage, it's not that high, And the instruction here is you just only need to soak it in newly boiled water and drink it as tea. A course is about 7 to 10 days. Then this is the formula number 2. Here you can see 7 ingredients, and the dosage here are much higher. And instead of drinking it as tea, by just only soak it in boiled water, for this one you have to cook it. You use you put these ingredients in a pot, then boil it with water. So 1 set of this is good for 1 day, and can drink it for 2 times and have it also taken for 7 to 10 days. Here you can see 2 pictures. One on the left is a medical staff in one of the hospitals there who is in a office, and you can see at her back near the neck area, a pouch was placed there, for building up her immune system. And on the right side, this picture, is my staff here in Manila. She is pouring the tea and preparing to drink it for prophylaxis. So let's go to the summary. Based on the above report, we may realize the importance of traditional Chinese medicine. It plays a vital role in life-saving, and it is really worthy for us to learn from China their valuable experiences. Of course, in some situation, and it is very normal for some people who are still skeptical and have no confidence on the efficacy of this traditional Chinese medicine. But there is a saying, time is of the essence. So we still recommend, early diagnose for early treatment. For early diagnose is the key to successful treatment. Hope not to wait until it is too late. So before I end this report, may I quote to you a passage from a TCM Asian literature called Su Wen of Huangdi Neijing, the chapter that discusses on how to tune in the spirit during the 4 seasons, that states, the saints do not treat diseases, but heal diseases before its onset. Okay, not waiting till the disease to become complicated, rather treating it before having complication. So that's the end of the report. Thank you very much, and always keep safe to all of you.